When do you need Roman 4 antibiotics for diverticulitis? Have you ever wondered when intravenous antibiotics are necessary for diverticulitis? This condition can vary greatly in severity, and understanding when Roman 4 antibiotics are needed is crucial for effective treatment. Intravenous antibiotics are typically required for patients with complicated diverticulitis or those experiencing severe symptoms that necessitate hospitalization. This includes situations where there are abscess formations, signs of sepsis, severe abdominal pain, or peritonitis. If a patient cannot tolerate oral intake, is immunosuppressed, or has significant other health issues, Roman 4 antibiotics may also be indicated. For patients with acute and complicated diverticulitis, Roman 4 antibiotics may be necessary if they are frail, elderly, particularly over 70 years old, or if they have persistent symptoms like vomiting or a high inflammatory response. This response can be indicated by elevated levels of C-reactive protein or white blood cell count. When it comes to complicated diverticulitis, this often involves localized abscesses, perforation, or signs of systemic infection. In these cases, Roman 4 antibiotics are essential to cover a range of bacteria, including gram-negative and anaerobic bacteria. Common combinations used include coamoxiclav, cefuroxime with metronidazole, or piperacillin tazobactam. For severe or inpatient cases of uncomplicated diverticulitis, patients who meet specific criteria, such as experiencing sepsis, severe pain, being over 70 years old, or having a compromised immune system, will receive Roman 4 antibiotics. This treatment is often accompanied by fluids, pain management, and bowel rest. Typical regimens include piperacillin tazobactam or ciprofloxacin combined with metronidazole. Immunocompromised patients face a higher risk of complications. They may present with milder symptoms but still requiring a low threshold for imaging and Roman 4 antibiotic treatment. Broad-spectrum coverage is often necessary, and the treatment duration may extend from 10 to 14 days. Generally, Roman 4 antibiotics are administered for 3 to 5 days until there is clinical improvement. After that, patients are usually transitioned to oral antibiotics to complete a total treatment course of 10 to 14 days. In summary, Roman 4 antibiotics for diverticulitis are primarily reserved for patients with complications, severe disease, or specific risk factors that requiring hospitalization and close monitoring. Mild, uncomplicated cases without risk factors can often be managed with oral antibiotics or even without antibiotics, depending on clinical judgment. Always consult a healthcare professional for personalized medical advice regarding treatment options.